Good afternoon, everyone. My name is Coletta Dorado. I'm the founder and CEO of AZZLY. Thank you for joining our summer educational series. We're really glad you're here. We're inspired to offer this series over the summer months to cover some common challenges faced by mental health and behavioral health and substance use providers, substance use disorder providers, and those that bill for those services. We want to offer some key tips that help solve those challenges within AZZLY Rize, and that's why we've brought the team together today. Today, we'll demonstrate how supervisors can review alerts and either sign off or reject encounters and group notes to support better compliance and boost timely reimbursement. A little bit of housekeeping I skipped over. If you have any questions, just put them in Q&A. But that's the best thing, and then we'll answer them accordingly. We do have you on mute just so that we can get through this quick 30-minute presentation. But again, we really appreciate your feedback and your input and any questions that you might have. So today's demo is going to be presented by Maria Gray, LPN. She's our product manager and lead on-site implementation specialist. Maria has an extensive background in working within mental health and addiction treatment clinics. She works very closely with our clinical and medical teams, as well as our product development team, in order to bring your ideas, your feedback, your real use cases to the table so that we can continually improve what we offer both on the clinical side as well as on the medical side. Tracy Briggs also is on board today, LPN BS. She is a senior implementation specialist. Tracy has over 30 years experience in healthcare services. She works hand in hand with our locations, all the clinics on the clinical, medical, intake and admission side, as well as revenue cycle management. Tracy is an expert in all that she offers and brings back much of your feedback and recommendations so that, again, Maria can work with the development team on any type of enhancements that could be required to make your jobs easier. Lastly, but never to be forgotten, Heather Junkins, Revenue Cycle Management Specialist and Billing Manager. Heather is 15 years experience in the RCM area. She is an expert medical coder, and she works very closely on the transitional billing and the training and implementation that we offer to those that join AZZLY. And as you consider bringing billing in-house or have any third-party billers work within AZZLY in order to do your experience. So we're thrilled to have this great team to share some tips and tricks on AZZLY, and hopefully you can walk away with some great ideas. I do want to quickly share that last week I was at a HBMA Owners and Managers Conference in Minneapolis, St. Paul. There were over 50 billing companies that attended throughout the USA, and they were very engaged in a really sharing audience. I was impressed. I went there truly with an interest to speak to billing companies to see if I could entice them to support the billing needs of treatment programs and mental health programs that we serve. It was interesting, out of 50 billing companies that attended, only 2 served in our marketplace. It further supported why we've done what we've done in billing, in incorporating revenue cycle management, billing and claims within the AZZLY Rize platform. I did receive a very warm welcome, and I'm really hopeful that more will become experts in mental health and substance use disorder to offer their expertise around the country. Most treatment organizations that come to us are looking for that all-in-one solution, the clinical and billing, and want to bring the billing in-house for more accurate coding and claim submission off of the clinical services that are provided. So really pleased with the feedback that we got. Really welcome all of those that have billing entities, all those that are doing billing in-house, all those that are considering doing it. We're hopeful that what you see today will entice you to get more involved and maybe use some more features and functions that AZZLY has to offer. So with that, Miss Maria, I'm going to turn the presentation over to you to kick it off.
Thank you so much, Coletta. I will go ahead and begin sharing my screen. Now, as Coletta mentioned, in many clinical environments, it is vitally important that the clinical documentation be completed thoroughly and accurately, not only for the sanctity of the patient's record, but also to ensure compliance with licensure and to make sure that those claims that we were just talking about do get paid in a timely manner. AZZLY does have features in place to help facilitate the aforementioned. So for today, as Coletta said, I'm going to act as a therapist by the name of Sydney, who is supervised by Tracy Briggs, and I will be completing an encounter and going through the workflow for supervisor review of an encounter, as well as touching base on that feature being available within a group note as well. So as you can see on my screen, I've already jumped into the encounter itself, and I have started by going ahead and filling some of this out, saving some of your time today by not having to wait and watch as I went through this. So I have filled out my DAP note fairly thoroughly on my patient, and I feel good with it. So I'm going to click save at the bottom of my DAP note within my encounter and finalize and sign it. So as the clinician, my portion is complete, and I am ready to turn this over to my supervisor.
So in our scenario today, I'm Tracy, the supervisor. So I'm responsible for reviewing the notes of my team members, not only to make sure that they are capturing the excellent care that we provide, but also to make sure that we protect their license, my license, the company's license and compliance and billing, all the good things that we need our documentation to accomplish for us. So what happens is when our clinicians sign things, if we have the system configured to do this, I will receive in my work screen, you can see that we're in my work area, an item that will have this red icon over to the right. That indicates to me that that is a encounter that this clinician has completed and finalized and wants me to review. The system sent that to me automatically. The clinician did not need to send me a manual staff alert. It appeared in my work screen when she clicked the finalize button. So she's now clicked that, or I've now clicked that red icon, and that opened the encounter so I can review it. So now I can scroll down and see all of the appropriate documentation that she's completed and decide whether it meets our needs. If I find a problem and there's something that I need to change, or I would like her to change, excuse me, I will have the ability to unfinalize and reject that note. Just by clicking the reject button, I can enter a note and send it back with the encounter to the clinician so that she sees what I'd like her to change. So in this case, let's say that I've decided that I would like her to note the new diagnosis that this patient was just given this week. Great. So I can click reject. And now that item, you'll notice, has left my work screen. Now, before we see what that looks like for the clinician on her side, I'd like to take a minute and let Heather show us what this looks like for her. Heather is going to be our billing person today. So she's going to demonstrate how those claims appear on the billing side for her team.
Great, thank you, Tracy. So on the billing side of the AZZLY system, compliance is just as important as the clinical side. So the system works hand in hand to keep you legally compliant within your claims as well. Coming into this auto generate claims tab and setting your date range will allow you to search, and the system will display a list of appointments that have either been checked in or encounters that have been created. If you expand those and look at the line item descriptions, you can also see a color-coded circle at the end of each one. The legend at the top right corner will expand and give you a definition on the status that this appointment is currently in. And you can see if it has the gray circle icon, that means the appointment has only been checked in, no signatures and finalization have happened, so compliantly, your biller knows they may not submit this claim. Moving down through the list, you notice that the color-coded icons that are billing friendly appear in either gold and pink or green and purple. The two separate sets of definitions will indicate if there had been a supervising provider attached that needed to sign off, as well as the rendering. Once your billers move through and pulled out all of the compliant ready claims to be submitted, they can come up export the list of claims that still need provider attention and bring that up in team meetings so that the providers know what action needs to be taken on their behalf. And that's it for the billing side. I'll turn it back over to Tracy and Maria.
All right. So that shows you what it looks like from the billing perspective. And I'd like to point out that if your workflow isn't that you have a team meeting, I, as the supervisor, can see on my work screen anything that's outstanding. My clinicians can see on their my work screen anything they have outstanding. So it isn't all up to the biller to point it out to the team. Everybody has their own accountability, and the system will create that accountability with this automatic workflow. So now that I've rejected that claim, Maria, you as the clinician can now see it on your side. Can you show us what that looks like?
Absolutely. Now, I did already click from the My Work screen into my encounter, so I received the red alert icon, just as Tracy mentioned when she was viewing her My Work, that let me know that I had an alert sent back to me by my supervisor that one of my encounters had been rejected and unfinalized. I can see at the top what text she entered as far as to direct me on what needs to be completed in order for this to be able to be acceptable. So I can say I need to add the new diagnosis to the patient's record. She was okay with my DAP note. So in this case, I know that this patient was recently diagnosed with a new sedative diagnosis. So I'm going to go ahead and add that to the diagnosis screen as she asked me to. Make sure that was done today, and then I will go ahead and finalize and sign this again and send it right back over to Tracy. Now, in addition to having alerts for, and Tracy, if you don't mind, I'm going to take over part of yours and not go back through my work, but there is also another icon in the My Work screen that can indicate when a group note has been finalized and requires a review as well. So looking at the group note that I just completed, I can see that it's pending approval. It has not yet been reviewed by my supervisor, but it has been sent to her. So I'm waiting for her to review this. Now, if she does review this and sends anything back to me, then it will immediately change back to in progress. And then I can click on any of these in order to find out why she may have rejected anything that she did. Otherwise, when she does review, she's able to go through, place a check mark next to any group note that is ready to be signed, and click the supervisor's signature button on multiple clients at one time, saving a lot of time and efficiency. Now, when her view of the group note will look like this when mine is pending, then Tracy will see the reject. So she doesn't have to reject the entire group. She can reject one by one. So if only one patient's note was unsatisfactory, then she can click reject for that one note, enter a reason for the rejection, and that works very similarly to the encounter workflow that we just went through. Okay.
We'd like to point out that the rejection reasons that we enter when we're rejecting them do not attach to the documentation. So that is just an internal conversation that you can have.
Thank
All
you.
right. Colette, is there anything else you'd like us to cover, or would you like to wrap up with maybe some questions?
No, I think it's great. Thank you so much. Wonderful job. And I hope that those that attended found it beneficial. We want to keep these little summer webinars brief, because we know that your time is precious and you don't have a lot of it. So here you go. We did get some questions that came in that were submitted. And Andrew, I don't know if we have anything in Q&A. If we have anything in Q&A, I'll ask you to read that. But here comes the first one for Maria. How long does it take for AZZLY to set up these encounters and group note supervisor rules for us?
Well, I have great news on that. While we're happy to assist with the setup of these items for any client at any time, we're actually able to best help by accommodating your schedules and spending approximately 15 minutes training the appropriate individuals within your organization on the configuration of this themselves, so that any future adjustments can be completed on your time rather than on ours. So while we're willing to help, it's easy and a simple process so that we can train you and empower you to do this yourselves, actually.
Maria, in your training and offering this, is it Is it pretty easy? Does it take a special skill set or is it pretty intuitive?
It's extremely intuitive, Coletta. The only thing that I would say regarding a skill set is, and it's not so much a skill set, is there is a specific privilege. And because there are other areas of the screen that can be impacted while this is being adjusted, we suggest leaving it to supervisors or those with the ability, the permissions to make changes throughout the system in order to make those changes themselves. That way we don't have clinicians by accident changing items that may impact billing or other areas.
Yeah, I've heard that from leadership at different facilities that they like the power to establish a standard, establish a best practice, and make sure that the staff isn't changing forms, isn't changing a process that they've established that they're very comfortable with, and for Heather's sake, is getting them paid. So
Absolutely.
great, thank you
you
on that one. Heather, here's one for you.
Thank
If a group note or encounter is rejected, how does that impact billing?
If it's rejected, then the color-coded circle that displays after that specific encounter or appointment will stay a gray color, indicating to the biller that signatures have not happened, finalization is not happened, and compliantly, they do not need to file the claim.
You know, Heather, you've been doing this for quite some time. You know, this feature that has been built into AZZLY and the color coding, is it unique to AZZLY? Have you seen it anywhere else? Do you get feedback from clients that, you know, the benefit?
Absolutely. The billers that we train that come in, and even the clients that do not have billing experience, love that they can in one area display the list of services that need to be billed and know which ones are compliantly ready to be submitted. It also helps to safeguard them against audits, which happen occasionally to every facility. And they know that following that color coding circle system safeguards them against a bad audit happening.
Okay, great, thank you. I had a question just pop up. Heather, maybe you can address this. What if we saw an account without a payer? Do we need to do something on it?
Yes, that means an insurance has not been attached to the patient chart, so no claim could even get out of the system with no subscriber ID or payer ID attached.
Thank you.
You're welcome.
Critical. So again, for a clinical and business solution such as AZZLY, a seamless one that goes right through our clearinghouse of validity, right to payers, it is very important. We like to say garbage in, garbage out. Setup is critical. And making sure that the information that you have is accurate, you know, is the first step. So thank you on that. Tracy, how can I be sure that all of my staff's notes come to me for review if I'm the supervisor?
Sure. So there are two configuration items that this whole process hinges on. You're able to first say, this staff member has a supervisory relationship with this supervisor, so that everything that they do goes to that person that I want to review that item. And you can also say on the note side, this encounter or this group note should follow that process. So for instance, if you have an intake, you don't need a supervisor to review the consents that the patient signed. That does not need to flow to the supervisor. So you can make that encounter outside of this workflow. But obviously your individual session notes need to flow. So that encounter would be set up to always follow this rule if a staff member who has a supervisor completes and finalizes that encounter. So it's the system is going to do the work for you. You're not relying on those staff members to remember to click that button to send you an alert that they completed some work. It's going to happen automatically.
May I piggyback on something that Tracy just said on that answer also?
Sure, please.
For anyone on who has not gone through our training and implementation yet, while we hopefully are making it sound simple, because it is, we also want you to know that this is part of the original training as we go through managed staff, getting you set up, is showing you how you assign that supervisor. And as you're configuring the encounter specific for your system, we'll walk you through how you can make those selections. So as Tracy said, it is part of configuration. And if you have been with us a while and you don't know how to make that happen, again, it's just part of a setup that we'd be happy to walk you through.
Great, thank you. Tracy, can there be more than one supervisory signature?
Yes, there can. You can assign as many supervisors as you need to an encounter or to a staff member. The first supervisor who manages that encounter or group note will then remove the item from all of the supervisors' My Work screens.
So one signature can get it all accomplished?
Right.
Thank you. Thank you. Heather, how about for you? We talk about the claims process. Is there any automation as far as you have encounters set up? You've got, do you bill your auto claims based on an encounter workflow process? Can you do that?
You can. So that's where the charge master would come into play. And if encounter and creation of that encounter was the choice that you selected for your facility to bill from, then the charge master would tell every time an encounter was created exactly what CPT code was attached, the charge, any modifiers or ref codes if it's an institutional claim, so that the billing side works hand in hand with the clinical side and all information populates automatically.
So Tracy, we know that payers can change fee schedules, contracted rates, make a lot of changes throughout a year. How easy is it for a facility and someone in charge of this to make those updates?
I think you might have met Heather on that, but
Oh, Heather, I apologize.
It's okay. So the AZZLY system allows you to house each payer that you plan to bill claims to electronically through our clearinghouse ability. We do that to cut down on human error so that the system recognizes and attaches the 5-digit payer ID that we use to submit electronic claims to each unique individual patient chart. That's how we use the Manage Payer tab. It's super, super simple using that 5-digit payer ID to enter the payer into your system so that it's housed there and able to be attached to the patient chart.
How about if you, another option, instead of using encounters, could you bill off of appointment types if the services that you offer are more, your charge master, your fee schedule can be tied to an appointment type?
Yes.
Does that
The
work
charge
in
master, I'm sorry, go ahead.
No, does that work in AZZLY, Heather?
Yes, ma'am, it does. So the AZZLY system is very customizable. We can set your charge master up with business rules that can kind of hone in on your billing as much as you would like to, or keep it as broad as you would like, just using an appointment type, just as Coletta just mentioned. And that would be scheduled on the calendar. And once it's checked in, it lists exactly the way that you saw before on my screen in that auto generate claims tab.
Okay, a couple questions came in, and if we can answer them, great. If we need to get back on the answers, that's understandable as well. How can we check the 2 denied claim with 2 same dates of service, but different total charge amount in one account? Not sure.
That sounds like a word problem from high school for
I
me.
know it.
I'm glad you do this, Heather.
So if you've got 2 dates of service that are matching, but you have different charged amounts, that probably means that the CPT code attached to either of those line items is different. If it's not, opening up the show button and going into the procedure will allow you to look at the claim level details in detail. So you can see the CPT code, the charged amount, the date of service, to make sure that you don't have a replication that has happened.
Excellent. Well, glad you knew the answer, Heather. Okay, and here's another one. If the account is inpatient, how to attach and where to get an authorization? Ooh, talk about authorizations. I like how we do it. Are we allowed to request the prior auth or not if the pre-auth is expired? Does that make sense?
I think so. Okay, then if I'm allowed to, I'll share my screen again so we can kind of look
There's
at this
2
together.
questions here. If the account is inpatient, how to attach and where to get an authorization. And then the second one is, are we allowed to request the prior auth or not if the pre-auth is expired?
Yes, okay. So first question, AZZLY will manage your pre-authorizations for you. This is a feature within the system that I love billing within the system myself. So if you open the patient chart and go to the insurance tab, scroll down just a little bit, you can see that add authorization button become visible to you now. When you click on that, it's going to open the manage authorization window. You can see that we already have one auth stored for this patient and this payer attached in their patient chart. So let's open that one up and we'll use it as an example. You always attach your pre-authorizations to a specific payer because they are awarded by that payer and need to be billed to only the Aetna policy. The authorization number would then go here. And then the notes field is kind of a free text field. You can put whatever you feel is pertinent to this auth number. The days and units will be entered according to how the pre-authorization was awarded. They will specify that in the awardance letter. And then, of course, you would use those calendar icons to set the date range that's tied to the pre-auth. Now, the AZZLY system allows you to attach this to the service that the pre-auth was awarded for. So using that drop down, what you see below is a list of services that your facility will render that is housed in your charge master. So if this pre-auth was awarded for the residential 3.3, then that's the service that you apply it to. And every time you generate this claim, that pre-authorization will auto-populate within the claim. So it cuts down on your billing team having to know, should I have an authorization here? It's a residential claim. It will just pull in automatically. Now, if you have an auth that reaches the end date or the expiration date, and you have not requested an extension or sent in discharge clinicals, you need to contact the payer. They are very individual and specific. Some of them will allow you to turn that into an extension request. Some of them, because the dates have passed, will require that you start a new pre-authorization. But you are completely allowed to request that from your facility.
Glad you're
Did I get all the questions?
I think you did, in my opinion. Great job. Heather, have you ever seen a countdown of prior auth in any other system?
I have not. So I'll share one more time and I'm glad that you brought that up because I left that out. Now that you look at your payer and your start date, you have your initial awarded visits that display first in the total visits column. And you can see that 4 visits are showing as a deduction in the left visits. This is a real-time count that your billers can see. Every time this pre-auth number is attached to a claim, it will count down by however many days or units are attached to that claim. So this helps you to manage those expirations or those days or units running out by looking, number 1, in the patient chart, or number 2, you set a review date as you near the end of the expiration date and the system will alert you, or you can run a pre-authorization alert report, and that report will show you when 80% of the units or days allotted have been used, or if you're within 7 to 10 days of the expiration date. So the AZZLY system covers you on the UMR side from every angle.
Excellent. Heather and team, thank you so much. We've got 2 minutes left. I do want to share with everyone that, you know, your team here at AZZLY, they've done some really nice videos with tutorials and instructions. Take advantage. We have the learning management system called AZZLY eLearning. You all have access to it. Just as you add staff, or you expand, or you want to learn more about what we have to offer in the system, please, 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 I encourage you to watch those. I also ask you to please, if you have any questions, any concerns, any suggestions as far as future webinars, clientservices@azzly.com, give us your thoughts, give us your suggestion, let us know what we can help you learn more about or expand your services in programs that you offer. I just, we're so glad you're here. We are just thrilled to be able to support your needs, and we look forward to the next one. Keep your eye on Eventbrite. Andrew tells me we'll have the next one. We try to give you at least 2 or 3 weeks in advance. Sign up for them. If you can't attend, at least you'll get the video, the recording of it. So again, thank you so much, and we're glad you're here. Have a great month of July. Happy 4th.
Bye-bye.
Thank you, team.